How does treatment medication affect sexual function?
Well, it's not just treatment medication that affects sexual function. There's actually lots of drugs that affect sexual function. And in fact, lots of people use drugs to enhance sexual function. So some people take drugs like ecstasy and Viagra, which is called sextasy. So instead of just wanting to hug the world, you might want to hug the world and do a little bit more. Some people have told me that the combination of cocaine and Viagra is called coke and poke. But that wasn't the question that I got asked. So methadone and buprenorphine and heroin tend to affect sexual function by reducing your sex drive. They lower your levels of libido and they reduce your ability to attain orgasm. But there's other problems that people who use drugs might encounter that also affect their sex drive. For instance, many people who are using drugs are depressed, and being depressed affects your sexual function. Those things aside, methadone and buprenorphine can reduce your sex drive and they can reduce your ability to reach orgasm. That can clearly be problematic. Unfortunately, it's not something that's commonly discussed in treatment rooms between patients and doctors. And my guess is that if it is something that is significantly impacting upon your relationship, and if you can't have sex, that's a pretty good reason to be, a bit unhappy, you need to kind of talk to your doctor. There actually may be a fairly limited range of things that doctor could do. But as we all know, there are medications that can assist in sexual function, but if you don't talk about it to your doctor, you're not going to be able to do anything about it. Methadone and buprenorphine don't just affect sexual function, but they have a real marked impact upon women's menstrual cycles. And so one thing that is very common is that people who are on methadone and buprenorphine who use heroin don't menstruate. And sometimes women equate not menstruating with not having a risk of getting pregnant. And of course, that's not true. You can ovulate and you can get pregnant when you are not menstruating. So our advice to people commencing methadone and buprenorphine treatment is that they need to think about contraception, and that if they suspect that they may be pregnant for whatever reason, and if you're not getting periods, it can be pretty difficult, come and talk to your treatment service and get a pregnancy test. But the real reason we'd want you to come forward and let us know is that we want to make sure we give you the best antenatal care as early as possible.